When you come into ECMC, you'll come in off Brighter Street like you always have. You'll go past the old ramp, which will be torn down for patient parking. You drive around the end of the building to access the ambulance bay. It's a pull-through system, so you don't have to back up.
Welcome to our new emergency department. For crews with critical patients who need trauma evaluations, they're going to go through these doors here. But for most cases, crews are going to proceed to the triage desk right this way.
Welcome to triage. You're going to tell the triage nurse here what you have. This triage is specifically just for EMS. At this point, we're going to ask for things of just some basic demographics and chief complaints. We may or may not take vital signs at that time, depending on if we're going to do direct rooming. At this point, you'll be given a room assignment, and we'll show you where to go next. From this point, we're still at EMS triage. And if you're given a direct room assignment, we could go down straight this way where you came in, and that would be considered the orange pod. We'll get to that in just a second. The other two initiation zones here, or like the other three, will be down this way. Our fast track area and something called the blue pod, which is also a med surge pod. Sometimes we'll have provider and triage care initiation, and we'll go this way. So again, as you came in, this was your triage desk. And on some circumstances where rooms aren't directly available, we're gonna bring you into this area. So this area would be a provider and triage care initiation point on which we just made deposit your patient directly from your stretcher, and then they'll be given a room after that, after care has been initiated. This is the care initiation zone, or otherwise sometimes called provider and triage. This is a unique space for ECMC as a new thing for us with the build of this new emergency department. And other emergency departments have to sometimes retrofit some of their spaces to accommodate this. Our goal here was to ensure that we're not having a lot of hallway space use as care initiation, which we might have experienced previously. Coming from triage, which was directly behind you, we have rooms labeled A through F in here. Some of them have full stretchers, some of them are just chairs. We'll have a provider and a nurse directly here to start initiating care such as EKGs and some basic diagnostics. From this point, we may finish the care completely or transition the patient onto one of our main medical surgical pods. So again, all of our EMS triage will take place from this spot with this triage nurse. We just covered the provider and triage and care initiation there. If you have a patient that's here for behavioral health and for CPAP, we're gonna head over in this direction.
So just a few feet away from the EMS triage desk is our CPAP triage. In the past, crews have had to go all the way to CPAP to offload a patient. CPAP is further away in our new emergency department, so we've created this transition area for crews to offload their psychiatric patients in a secure private area, and so they can get back into service more quickly.
This is our trauma zone. Pre-hospital notification gives us a chance to get one of our 4 large trauma bays ready for you. The doors are right by the ambulance entrance where you'll come in and be directed into one of these rooms.
This is one of our main 4 new trauma pods. You can see it's quite a bit larger than our previous one. The trauma pods in this section will only be used for trauma patients, and you'll only be directed to these rooms if you have a trauma that was pre-arrival notification, or if we deemed it after we evaluated the patient in the hallway to have to come to a trauma room. You can see there's quite a bit of new technology in here. There's computer stations, there's an articulation of all the equipment we're going to need. In between all of the rooms is all the equipment that we're going to need to do resuscitation, and plenty of space to do it. Directly through there, just for point of reference, our 2 CAT scanners and main radiology platforms are going to be located in that hallway to streamline the care for our trauma process.
So this is the orange pod, or the acute care pod. A couple things to note is that if you do come into this pod and you have a cardiac arrest or a critically ill patient, we do have 2 resuscitation rooms here, numbers 44 or 45, so you will be directed to one of these larger areas that allow for enough space for enough personnel to come and attend to the patient. The other thing to note is that if you do have a trauma eyeball, you will come directly into this hallway right here, where the physicians and the residents can do their eyeball and determine if they need to go to the trauma bay or be placed directly into a room.
So this is the blue zone. This is another acute medical zone, much like orange. It has 2 resuscitation bays, as well as 2 secure rooms in the back for agitated patients who may need additional care.
From the EMS triage desk, it's a straight shot down the hallway to the green pod. This is our fast track pod. It has a combination of traditional beds as well as recliner chairs for patients. The idea is to get patients with lower acuity chief complaints to a single location where they can hopefully be treated more efficiently and get them back out.
From here, you entered from the ambulance bay, and you would make a right instead of going to left to triage. There's a couple of important features down this hallway in particular. First, there's an EMS staff room that you're able to sit down. There's a microwave, there's a refrigerator, just a place to maybe to PCRs and paperwork. Next down here, importantly, there's a sink right here in the hallway. And lastly, after this is not badge access here, and there is a bathroom to be able to use directly for EMS.